Now for the treatments of major burns, as mentioned before, during the emergent phase, the number one intervention in the first 24 hours, hopefully you wrote this down, we give isotonic solutions like IV lactated ringers and IV normal saline. Now, how do we know if fluid resuscitation is working or not? Well, the assessment of fluid resuscitation, big key term here, urine output 30 mLs or more. Huge NCLEX tip. Make sure to write that down. Urine output is a vital sign that indicates fluid resuscitation has been effective. So that's why we say 30 mLs per hour or less means the kidneys are in distress. Now, the second key point of fluid resuscitation is blood pressure. So 90 systolic or more and a heart rate less than 120 beats per minute. This means that fluid resuscitation has been effective. So I'd recommend pausing your screen and jotting these down. These were the most tested for fluid resuscitation. So don't let the NCLEX trick you here. Electrolyte balance is not the best indicator of fluid resuscitation. It's always urine output, then BP, and then heart rate, the top three there. So Saunders mentions, a client undergoing fluid replacement after being burned 20% of their body about 12 hours ago. The blood pressure is pretty low, 90/50, a pulse rate of 110, and a urine output of 20 mLs over the past hour. The nurse anticipates which prescription. Okay, so look at the key terms here. The BP is definitely not looking good. We're probably going to slip into hypovolemic shock for sure. So increasing the IV lactated ringer solution is the best option. Now, once the client shows adequate urine output and urinating or diuresing over 30 mLs per hour, then we can administer enteral feedings once bell sounds return. Nutrition is always a priority, but only after fluid resuscitation. This helps the client meet caloric intake required to rebuild damaged tissues from a burn. Now, as the body heals with open wounds from major burns, infection is a huge deadly risk here. So Kaplan mentions, a patient with burns who is immunocompromised, what precautions should be taken to prevent infection? Now, the key words here are immunocompromised and prevent infection. So avoid placing fresh flowers or plants in or near the client's room. Yes, we always want to avoid crowds, fresh fruits, and all the typical stuff for clients who are immunocompromised to prevent infection. Now, during the rehabilitation phase, this happens when wounds fully heal and typically takes around 12 months or so, depending on the severity of the burns. Now, the big key point to write down is that infection is not a big risk here. As wounds have been fully healed, there's no more open sores. So don't let the NCLEX trick you here. Infection is not a big risk. 80% of students get this wrong. So pay attention to the W's here for patient education. Big NCLEX tips. First W is for water-based lotion, which helps to minimize itching and scarring to allow the skin to fully heal. The second W is to wear pressure garments. Yes, don't let the NCLEX trick you here. Wearing pressure garments are good to help minimize scarring. It also helps to keep the skin and tissues tight while promoting circulation to be able to fully heal. And E is for exercise daily with range of motion. This helps to promote movement and prevent stiff joints. And we always encourage sunscreen and protective clothing when going out in the open sun to prevent those darn sunburns. Alright, that wraps it up. Thank you so much for watching. Don't forget to take the quiz and download the study guides.